So guys, Haller cell and Onodi cells में लोगों को confusion होता है, which is what? These are abnormal ethmoidal cells. These do not need to be there, and because nobody expects them, sometimes if you enter into these spaces, you can cause certain surgical complications. That's why they are important. अब conceptually तो teach करना मुश्किल है क्योंकि concept ही नहीं है. It is based on the name of certain people. But Haller cell, I can explain to you with a trick that you will remember without much difficulty. So सबसे पहले समझना है, Haller cell में दो L लगते हैं. एक L लगता है पेशेंट का और दूसरा L लगता है डॉक्टर का. पेशेंट का L है lamina peparisea. You see this is the coronal section of the paranasal sinus. You can see the orbit over here, and this red line, this is the lamina. Lamina मतलब thin line. Lamina peparisea मतलब papery thin. Peparisea. This lamina peparisea is lining this medial part of the orbit, medial inferior part of the orbit, separating the orbit from the paranasal sinus. And इधर ये जो है, this is the Haller cell. It is attached to this lamina peparisea, and while doing FES, which is functional endoscopic sinus surgery, we are going from inside, looking through an endoscope. We will think these are all ethmoidal cells, but we do not know that the Haller cell is there, because if we break the Haller cell, it will break the lamina peparisea और patient का पहला L उसी में लगता है, because then all the orbital contents will enter the paranasal sinus. Patient can go blind on the table, and तब लगता है दूसरा L डॉक्टर का, which is called as the license. Your practicing license का L लग जाएगा. So these two L's are very important. That's why ये साथ में है, because lamina गया तो license गया. So every doctor, especially an ENT surgeon who is performing functional endoscopic sinus surgery, should do a CT scan, coronal section, to see whether there is a Haller cell, and make sure that दोनों L नहीं लगे, सिर्फ इधर ही लगे in the spelling of Haller, जब पैदा ही दो L से हुए थे. And other cell is Onodi. Onodi is not so difficult to remember. Onodi is basically seen in the sagittal section. This is sagittal section of the paranasal sinus. This is the nose. This is the eyes. This is basically the eyeball. And this is the optic nerve. Now this optic nerve near the sphenoid sinus के ऊपर ये जो red है, these are the Onodi cells. These are also abnormal ethmoidal cells. And this, if you look at the word sphenoid, how I remember it. So sphenoid के नेम में ही O-no-D है. Alright, and also people remember it O-no is because of the optic nerve. बहुत सारे तरीके हैं. But in Haller's and Onodi, there should not be any confusion, because Haller's is just below the orbit attached to the lamina peparisea. Onodi is on the sagittal section in the lateral part of the sphenoid sinus, very close to the optic nerve. During FES, if we are not able to identify these cells beforehand and be careful during our surgery, then there is a chance of injuring the orbital wall or the optic nerve, causing blindness, and that is a medical negligence. So that's why these abnormal ethmoidal cells are asked a lot, and I hope with this approach you're going to be able to remember it. और कोई tricks या conceptual teaching चाहिए on any topic, in the comment section below.